Welcome to the Beauty Beyond Bella podcast. I'm your host, Dr. Yvette Suarez, owner and medical director of Bella Excellence, a diamond-accredited anti-aging med spa in the Tampa Bay, Florida area. On this show, we explore the latest trends in health, beauty, and anti-aging medicine while celebrating the inspiring journeys and achievements of our guests.
Welcome. Today we have this amazing surgeon, Dr. Figueredo, with me. I have a lot of personal stories with her. I don't know if you're aware, but 1 in 8 women have breast cancer. And when I was diagnosed 3 years ago, she was my surgeon and she helped me through my journey. So I thought it was really important to bring this amazing woman in and to kind of go over what we would need to know, what our journey is going to be like. But first, we need to talk about where this woman got trained. She has such a great thing. So when I look at here, you went to med school in Dominican Republic.
Yes.
So I love this. Another Latina entrepreneur. And then she did 5 years in Philly for general surgery and then 1 year of breast surgery at Brown. Tell me why you decided to really kind of funnel down and go into breast surgery.
So I have always loved doing procedures. I love general surgery, but my mentor during my residency, he was sort of retiring into doing just breast. And so I spent a lot of time with him. And what I learned to love was the time that he was able to spend with the patients and the relationships he was able to build. And so with general surgery, I felt like we did surgery, we cured the disease, we saw them for a post-op visit, and then the patient was gone until they or a family member needed you again for another general surgery issue. With breast care, whether it's benign or malignant disease of the breast, I had the opportunity to really get to know the patients and their families and continue to see how they do beyond their diagnosis, and I loved that relationship. The other thing I love about breast cancer care is that it is a growing field, and we make leaps and bounds with diagnostic and therapeutic treatments within years. So within 10 years, this could be completely different, and we're getting so close to a cure, and maybe one day surgery will be phased out and you won't even need a breast surgeon to treat it. So.
Wouldn't that be amazing, right? We talk about breast surgeries being the only outcome. I know we talked about mastectomies, we talked about lumpectomies. I think when a woman comes to your office, right, they're so vulnerable. This is probably one of the worst times of them getting a diagnosis, and probably the best times when you're told they're benign. I remember showing up to your office and really not thinking anything. I knew 99% sure that it was nothing. I have fibrocystic breasts. It was just another little mass, and I was going to keep it moving. And I think we kind of felt the same, right? I'm healthy, I'm young. And I remember we had this big conversation whether I should just wait 6 months and do an MRI or versus get a biopsy. And I came in that day going, put a needle in it, let's just keep it moving.
Yes.
And you said where it was located, it wasn't really going to be safe to put a needle in the office. And so we kind of talked back and forth, and listen, we're all really busy in our lives. And I knew that if I postponed that, I could potentially leave it to the side and forget about it. It was very tiny, and I didn't think it was anything. So what was the probability that I would really come back and really be an advocate to continue to find that? And so I decided for the biopsy, and you kind of know what's next. But talk to me a little bit about what is that journey like when a patient comes in? I was probably very different, right? Knowing a little bit too much, I think sometimes is a bad thing. What about everyone else that comes in?
So every situation is different, but whether you're in my office because you have abnormal imaging or you feel a mass, whether it's benign or cancerous, it's the same experience. It's scary for everyone to have to be in there for an issue. So we try to talk about all of the options, present the options to the patient, and try to inform you and guide you as to which direction we think you should go. In certain scenarios, you can follow things, especially if we think they're typically benign, but it never hurts to do a biopsy if we think it's needed just to make the diagnosis. And sometimes for some patients, even if it's benign and we recommend a biopsy, it really does give you some peace of mind to have had a biopsy and know what you're dealing with at that time. In your case, fortunately, it helped us make an early diagnosis, which, as you know, leads to a better survival and longer disease-free periods.
So tell me a little bit about what does help you early detection. What size? What are women looking for? What should they be doing at home?
So it's really important to be familiar with your body. I think that in today's world, we're so rushed and busy with other things that we don't take time to slow down, to examine ourselves. So the best thing that you can do is just know what your breasts look like, including the skin and nipples, I always tell my patients before getting into the shower, take a look at yourself in the mirror, make sure that things are symmetric, that there are no rashes, no changes with the nipples pulling inward or drainage from the nipples. When you get in the shower, you want to soap up your hand and do a self-breast exam. And if you don't know how to do one, you ask your physician to teach you how to do one. It's a simple thing that can be done, and it doesn't have to be done every day. I tell my patients try to do it the same time every month so that you know what the normal texture of your breasts is, and so if there is a change or something new that you feel, you'll be able to bring it to your physician. A lot of patients say to me, well, I don't know how to examine my breasts. Everything feels lumpy. It's difficult to know. But I think that the more you practice this, the more familiar you are with how your breasts feel and look, then if there is a change, you're going to know, whether it's an early symptom, a tingling, a pinching pain, a pulling sensation, anything like that that's new or persistent or worsening, or a mass that you might feel that is increasing in size or new. Those are things that you want to bring to your physician's attention so that they can order the diagnostic workup.
I agree. Imaging is not always going to catch it as you know, for my case. And it was really about us knowing our own body. And I tell people all the time, I literally would just go sleeping and I had my arm tucked in like I normally do. And I was rolled to the side and I felt a little tiny pea size. And it was so far lateral that I actually didn't even think it was part of my breast tissue. I thought it was a lymph node. And of course, as a doctor, I go, oh, great. And I have lymphoma, right? So I'm looking at it and I'm feeling it. It wasn't tender, which I would have expected for a lymph node. This was non-tender, which is not always great, right? Non-painful, hard, little tiny pea-sized nodule that I could feel. And so I kept rolling on it and playing with it for about 2 weeks. And then I decided, this has never been there before. This needs to be good. Even if it was nothing, it needs to be checked. Right. Like you said, I've, lots of bumpy lumpies, and it's kind of hard to know. Thank goodness it was in an area that I could feel and not internally where I could not feel. And so that was really helpful for me to get such an early diagnosis and not, and have a good outcome. But it's really up to the women to come in and do this and follow their mammograms and follow their ultrasounds. We have a lot of young women that have thick breasts. What do you say to those women that really can't get a mammogram?
So I actually was going to touch on the mammogram. I think, as we talked earlier, in order for something to be palpable, a lot of times it has to be a centimeter or larger in size. So we really don't want to wait until things are palpable or even visible under ultrasound. So the standard of care really is the mammogram. And I get a lot of pushback from patients about obtaining a mammogram, patients that feel like it hurts too much to do it, feel like there's too much radiation exposure. Really, the amount of radiation that you're exposed to during a regular routine screening mammogram, it's less than what we get exposed to in our environment on a daily basis. And it saves your life. So you can find microcalcifications. Now, microcalcifications are small specks of calcium in the breast. Not all microcalcifications are cancerous, but certain types do have a higher suspicion to be associated with the earliest form of breast cancer we can find, called ductal carcinoma in situ. And that can only be detected on mammogram. We cannot see that with ultrasound. We cannot see that with MRI. There are newer modalities coming out, and I've already been asked about the QT scan and things that are, new modalities that have not been proven yet, as far as I know, and I'm still looking into the research on them. But those are really, great things to be looking into. How can we make screening easier, safer, more comfortable for patients? But until then, we know that mammogram works at detecting breast cancer at its earliest stages and does save lives. So we do recommend that the general population start screening with mammogram on a yearly basis at age 40. Now, there are some people who are higher risk because of family history or personal history of having prior biopsies that were abnormal. Some people are genetic carriers, so they're at a much higher risk of developing breast cancer. So in addition to mammogram, they may also need other modalities such as MRI or ultrasound to help with their screening. Patients who have very dense breasts are at an increased risk naturally to have an increased risk for breast cancer, but also things may be missed on mammogram alone. So it's really important to be sure that you are asking for and obtaining a 3D mammogram when you go for your screening mammogram. And if you are one of those patients who are either heterogeneous or extremely dense, that's a description that the radiologist put on your mammogram report. If you fall into one of those categories, you may be at a slightly increased risk for developing breast cancer or for having a breast cancer missed on mammogram. And so you could ask your physician to order a supplemental ultrasound or possibly MRI to help look through that breast tissue differently than just mammogram alone. But absolutely, I recommend that all women go and get their mammograms once a year.
Yeah, and I try to tell everyone that comes in my office, look, I see, 20 people a day, so at least 2 of them have had breast cancer. Most of them know someone else with breast cancer, which is a really scary process. And you're right, look, I'm not a big fan about radiation. Nobody wants radiation. We go to the dental office, we get x-rays for everything else. But I will tell you that I was always getting a mammogram every single year and an ultrasound. I am the one that's blessed with the fibrous tissue and very thickening. So I got that every year, but that was very different. Now I get it every 4 months. Every 4 months I have to get an ultrasound, a mammogram. Every 6 months I get an MRI. Every year I get a PET scan. So talk about having to increase your risk of radiation is once you have a diagnosis, it becomes very different as far as the care you have to take. So you're right, preventing it by just a simple little test every year is going to be key.
It doesn't necessarily prevent it, but it helps you catch it as early as possible. And the earlier we catch it, the less invasive the treatment may be, and also the longer you're going to live beyond that diagnosis. So I think, sometimes patients will be like, well, I just had a mammogram 3 months ago and it didn't show up on there. We call them interval cancer, so things can develop between imaging studies. And so it doesn't mean that it was necessarily missed, it just wasn't visible yet. But the more regular you are about getting your screening mammograms or ultrasounds, then it's easier for the radiologist to detect a change. So that's why we recommend them annually, so that they can look back at your priors. And I think it's also important to state that I really think it's helpful to go to a dedicated breast imaging center where you are going to have a better experience as far as comfort, because the technologists doing the mammogram know the amount of compression. They're not going to over compress you. They're used to doing mammograms every day or ultrasounds. And also you have a dedicated breast radiologist who only is reading breast imaging, and so they have a keener eye for picking things up. But I think it's also important to stay with the same center every year. I do have patients who bop around from different centers, and so it's really hard to make a comparison. One, the imaging technology is different from place to place. The images are different. The quality of the images, the person reading them are different. And so the more consistent you are with location and person reading them, and also getting them every year, will allow us to make a better comparison and catch those subtle early changes.
It's so true. I went through that. I had the same place doing my imaging, and finally one day I couldn't get an appointment and I got really frustrated and I went somewhere else and got imaging done. And don't you know, they messed up my imaging and nothing came out. So no longer did I have to go back and redo the whole time thing. But what I really appreciated, when I went to the same facility, I actually had the same breast radiologist reading it. And so she already knew who I was. She already knew what my care was. She knew who you were. And so we had this plan. We were able to kind of talk about the game plan going forward. And that gave me a little bit of security, right? It wasn't someone that had no idea who I was or what they were looking at. Oh, you have 3 new masses every time I went in there. But it was a conversation. What are those masses? Could they potentially be benign or not? I think that's the scariest part. But I love that. Like, I think as patients, we're not self-advocates enough. And maybe I'm a little different because being a physician, I've had a little bit of knowledge behind that, even though I learned tremendously more about breast cancer. But how do we empower the layperson that has no medical knowledge to really go and be their own self-advocate?
Well, you and I spoke earlier, how difficult it has become to navigate the healthcare system. And, that's one of my frustrations as a physician. I hate to see delays of care. I hate to see people floundering around, not knowing where to go or what the next steps should be, or waiting for appointments. And unfortunately, with population growth and maybe decrease in availability and access to physicians because of, COVID and all of those things, it's made it very difficult for patients to know what to do next. And so I think it's going to be important in the future to have more patient care navigators in our systems so that we can help guide patients and tell them where to go, or if they have an abnormal diagnosis, really, hopefully the imaging centers will be helping them know what the next steps will be, or getting them set up for their next appointments, either with a surgeon or following up with their primary care physician. But I tell my patients, I think it's really important to be a self-advocate. So, and I do think a lot of patients are really well educated and they know what they need. It's just a matter of knowing how to get it. And I think that as healthcare providers, it's our responsibility to help educate them and help get them in as soon as possible. But I always tell my patients, if you have anybody take an image of you, draw blood from you, put a knife to you, or do a needle biopsy, you really can't sit back on your haunches and think, no news is good news. If you don't hear results of any procedures that you've had done, or you're waiting for lab work to come back and you haven't heard from your doctor's office, I really encourage patients to make that phone call about your results, be your own best advocate, because the sooner you know that it's nothing to worry about, the better you're going to feel. You can move on with your life. But if it is something abnormal, you can get it taken care of quicker. Being a physician, I see how things can get lost in the shuffle. We're extremely busy. There's a lot of different systems trying to communicate. So I really tell my patients, you are your own best advocate, and you're also the advocate for the rest of your family. As women, we oftentimes lose ourselves in the daily shuffle, taking care of others, our children, our spouses, our work, and we lose ourselves. Not only do we have to take care of ourselves to be able to take care of others, but we also have to take care of the people in our lives that are important to us and make sure that our friends and our family members are going and getting their mammograms, are checking their breasts, are taking care of things that are new and not just ignoring them because life got in the way.
I agree so long. I had a patient tell me the other day that she was just diagnosed with a little breast mass, and she was going to it was 3 months for her next appointment to even get evaluated. And I said, you need to go get a mammo now. You need to go get your testing done. You need to get a biopsy now. I'm busy. They don't have appointments, so I'm going to wait. And I was like, no. I remember when I had to have the biopsy, I think I called that radiology place every single week until they got me in. When they told me I couldn't have an MRI that I needed to get done, they told me to wait 4 months. And I'm like, I'm not sitting here waiting for months. I called every facility until I found an opening. We do that for everything else in our lives, right? For business, for our family, but we need to do that for ourselves. We need to take the initiative. And it's funny how we just put that aside. We think that if we ignore it, it'll go away. And it's not. Like you said, if it's there, it's going to continue to get worse if we don't catch it early.
That's right. And I'm not saying if it means staying at the same center that you continue to wait. No. If you can't get in within a week or 2 weeks, then find somewhere else. There are other places, and you need to call every week, like you said you did, and see, are there any cancellations? Is there anyone else I can see? Certainly I'm not the only breast surgeon in town. There are plenty of them. So if you're having trouble getting in with one person, go and make an appointment with someone else. If you feel like you're not connecting with your surgeon or your oncologist, you're welcome to get second and third opinions if you want. You need to feel comfortable with your team, and you need to feel like you're getting the care that you deserve.
I did at least 3 consultations. I would recommend for everyone to do at least 2. You need to find that fit. Look, we had this amazing banter, and I knew that you kind of felt what I felt, and you were able to be there for me. And I know as physicians, look, it's really difficult. You're going in and out. You see this every day. But there were many places I went to where I believe in empathy. Like, this is an area where we're emotionally so unstable, right? We're scared, and we try not to be afraid. And to have somebody come there with facts, but also with empathy. And I think sometimes that's lost in our profession because it's something you do every single day. And there's been so many surgeons that I had met that really lost that. And that was kind of, I wanted to really humble them and know, we're all patients. At one point, this can happen to any of us. And we really need to lead with that care.
Yeah, I think you were in a very special situation because you're a physician. And so being on the other side of the table is very different and difficult. I haven't been the patient yet. It doesn't mean I won't be. But I think one of the gifts of this profession is that it lets me see what people go through, and that, life is so valuable and delicate. And then, every time someone has an abnormal mammogram or abnormal imaging, it means something to them. So we really do have to go back to that human experience and feel what they're feeling. And for me, it's a gift because it allows me to really appreciate the day-to-day. We oftentimes, take life for granted, take our health for granted, take our friends for granted, our family, the important things in life. And we focus so much on work and money and, just the fast pace of daily life. And I think that, when I go through this with my patients, I try to remind them that, yes, it was a diagnosis. Yes, it's devastating. It's scary. It's going to be life-changing, and your life will never be the same after a diagnosis. But it doesn't mean that it has to be bad. I mean, you can take the other side of the coin and realize that you've been given a second chance at life, and you got a diagnosis, it's there. Now we have to take care of it and we have to move beyond it. And how we move beyond it is very important, because I think that you could, yes, let it take over your life, destroy your life, become depressed, and it's not to say that you can't cry or be depressed sometimes, but I think that if you look at the other side of things, that, okay, I'm going to get through this. And when I do, I'm going to appreciate my life, and I'm going to make my life as fulfilling as possible, and I'm not going to worry about the small things. So I do think that it changes people's outlooks.
The Formula Wellness 4 cornerstones are nutrition, functional wellness, aesthetics, and brain health. These serve as a guide rail for individuals that are pursuing longevity inside and out. Formula Wellness is setting the new benchmark in preventative healthcare and aesthetics. Thank you for all of your support. To learn more, please visit www.formulawellness.com.
It was kind of interesting on our last podcast with Sandra. I talked about, I have an 80-20 rule in life, and 80% of the time I want to eat well, be well, and 20% of the time I get to be bad. And I said to her, we need to do the same thing as far as saying no. And I think we mentioned this the other day on the call, that 80% of the time I can say yes, but 20% of the time I need to learn to say no. I need to make time for myself. I need to take that moment. And even during my treatment, I went right back to work. I mean, probably a little too early, but this is how I felt. I went and got my radiation treatment every morning, and then I went to see my patients every afternoon. But it gave me a sense of purpose. Mm-hmm. I didn't want to be home and sad. I didn't want to cry. I wasn't going to feel pity for myself. Look, this is a common diagnosis for many women, and we're doing okay. I wanted to have that empowerment that I can show people you can still be normal, and you can still have a normal life. You don't have to sit home and just be sad. And I love that you said that.
Yeah, absolutely. And I think that each person's journey is different. So for you, maybe maintaining a sense of normalcy, going to work, having your purpose or your why was important to you. Now, there are people that just want to focus on their treatment and they don't want to work, and that's perfectly fine too. But I think that part of this whole journey is kind of figuring out what works for you, what makes you feel most comfortable, what makes you happiest, gives you the most peace getting through a diagnosis and treatment. And certainly some people's treatments are going to be more difficult than others. But like I said before, even a benign diagnosis is not something that's easy emotionally to get through. And so I think it is important to really focus on self-care. And I think that, I think it's very important for us to not only be our own advocates, but to take care of ourselves physically, mentally, spiritually, because it does get lost in the day-to-day life. And I think that if our bodies are well and our minds are well, then if you are faced with a diagnosis like this, it will only make you stronger during your recovery.
I remember trying to figure it out, and it was really difficult. So even I did all my consultations, I decided to make myself a little phone journey. And so I recorded myself every single day talking into my phone about what I wanted to do. And when I go back and look, I realized how indecisive I was. I would have one day go, I know this is the plan I'm going to do. This is why I'm going to do this surgical procedure. This is what I'm going to expect, and go through the whole medical part. And then literally the next day I'm like, well, maybe the other one's a little bit better. And I think I wavered back and forth, so many times that watching it was kind of disheartening. And I thought, if I couldn't even come up with a plan, how does everyone else kind of struggle through this? But like you said, this is a personal journey. And I tell my patients, just because I chose not to do chemotherapy or I chose to do whatever I chose to do, doesn't mean it's always the right choice for you. You have to know in your life what's going to be your best choice to save your life, to make sure that you have an impactful life in your family. And that's really difficult for us. And there's such a gray zone on that. That's hard for you to talk to a patient about that and help them through that journey.
Yeah, I think that, as physicians, it's our responsibility to educate the patients as best we can and give them the options and tell them why we might be leaning toward one or the other. And I think I told you this, I can't make the decision for you. I can tell you why you may need one thing or the other. I can present you with your options and the differences in survival and local recurrence and all those things. Ultimately, unless the disease dictates, there are some cases where you have to have a mastectomy because of the amount of disease you have in your breast, or maybe someone's at an increased risk because of genetic mutation or something like that. So we may recommend certain things because the disease is dictating it. But for the most part, especially if you're catching it early, you may not need mastectomy, and maybe breast conservation is also an equally as good option for you. A lot of patients come to me and they're like, just tell me what to do and I'll just do it. Or other patients come in and say, I just want them both off. It's not as simple as that, because there are a lot of downstream things that you need to consider when you're making those decisions. And so what I often tell patients is, well, what are you going to be most comfortable with? What's going to make you feel most whole when you're done? Now, for some people, it is doing mastectomy because maybe they don't need to do the imaging, or maybe they can't get through radiation, or maybe, you know, they're just so anxious they don't even want to think about the small possibility it could come back in the breast. Other people are completely comfortable saving their breasts because they want to feel the most like themselves. They, you know, that is what they identify with as being feminine, and that's okay. There are options for everyone, and I think that you need to be able to have those conversations with your physician. But really, it does take some soul searching about what am I going to be most comfortable with? What can I live with in the future? And not everybody needs mastectomy. Not everybody wants to save their breast, so it really is a personal decision, personal journey.
And there's no right answer. I mean, look, I felt guilty either way. I would feel guilty if I did one way versus the other. And I remember I decided to do the lumpectomy route and radiation. And I remember at 3 months, we had our next mammo and ultrasound, and they found 2 new tumors on the opposite breast. And the first thing I thought was, I should have done a mastectomy, right? I doubted myself. I thought, why am I going through this surgery again? And sure enough, there was back in your OR 3 months later, having another surgery on the opposite breast. Now, it happened to be an early, benign, and it was just starting to have some changes and nothing needed to be done. But it weighs on your mind. Like, did I make the right decision? Did I not? And, being a mom of 2 kids, I think that was the hardest part. Mm-hmm. So having support on a family, I don't know if a lot of times you get to bring the family in, and how are you able to, in your practice, help somebody emotionally and physically to get through this journey?
Yes, it is important to have your support system. So whether it's your family members or a best friend or coworkers or someone who's gone through it, not everybody is fortunate enough to have those people in their lives. So I do have people who come by themselves. I think it's helpful to have support systems in the program that you go to. So whether that's a nurse navigator or a social worker, support groups, those kind of programs will help support the patient. We also try to put patients in contact with other patients who've gone through, the American Cancer Society has a program where you can actually match up with patients who are the similar age, had a similar diagnosis or treatment, so that you have someone that you can share your journey with. Some people don't like to share, so that's the other thing we have to be aware of. Just because you've had a breast cancer diagnosis doesn't mean you want to wear pink all the time or have it written on the sleeve. I've gone through this. Some people are very private about it. So that's another part of the journey that people have to figure out, like when to talk to patients, when to talk to coworkers, I should say, or their family members or their children. How far along in the process do they start to share, if they share at all? Some people get through it and you would never have known they went through it. So I often tell my patients, you probably know people in your circle of friends or your work group that have already gone through and survived breast cancer and moved on just like you have and live a normal life. Looking at you, no one would know you've gone through what you've gone through, but I'm sure that experience changed your life, and hopefully for the better.
I mean, for sure, it's really difficult for me to share. I will say I'm a very private person. I think now that I've gone through it, I feel like God put me in this pathway to kind of make a change in someone else's life, to help them go through this journey. But while I was going, I kept it very private. And it was more because I didn't want everyone worried about me. I was so worried that they would worry. I just wanted to focus on myself. I didn't want pity. We don't want this diagnosis, right? You don't need to feel sorry for me. I'm going to get through this. And I knew I could. So I told a very few amount of people, and even they were shocked, right? And I'm like, but I don't need you to hold my hand. I just need you to be there when I need you, and I need to be able to go through this journey. And for me, it was really about going through this journey with God. I felt like God was the only thing that was going to get me through this. And I remember every day when I had radiation, I would say the Our Father, from the time I lay down to the time I got up. That was my inspiration. That one was going to get me through that. And that was, I think, very humbling for me to know that it was out of my hands. I'm going to do everything I can medically. We believe, and we'll talk a little bit about the functional medicine side of it, holistic side and traditional medicine, but absolutely that traditional part of it was really, really important for me. I have a funny little story. I remember, probably I shouldn't share this, but I remember the first person I actually was talking to on my phone on my way home, and I got the diagnosis, and I barely remember my ride home. I think I even went and stopped and got gas because I was just in this state of shock. And And I got home, and my boyfriend at the time was there. We were living together, and I said, I need to tell you something. And he kind of looked at me. He's like, I've never seen you serious. What's going on? I said, I need you to sit down. And he didn't know what it was. And he turns around and he looks at me. He goes, are you pregnant? And I was like, oh my God, no, that could be worse.
I just said, you could put my coin. I said,
I said, that could be worse. And he's like, really? And I started laughing. I'm like, it's not worse, but it was just such a hard thing to tell people but I love that. And you're absolutely right. It's just the journey that everyone will take, whether they want to tell, not tell. But you guys have a really big impact to that. And I just want to let you know that you guys are somebody that we look up to, and that every time I come in, that support of that follow-up is really important.
It is, and that's why I love breast cancer care, is because it allows us to have that relationship, and I think patients really need to be heard. And so as providers, it is our responsibility to really listen and see what the needs of the patient are, so that we can make the best plan together, because we're a team. And if you don't feel comfortable with your team, then it's going to make it hard for you to get through it.
So you sent me to an oncologist when I got diagnosed. That was a really hard thing for me. I remember one of the first times, I never cried when I got my diagnosis, but I remember walking down the hallway and going down, and the top of the door said oncology. And I was like, oh my God. And I had this feeling of dread, like, wow, that's me. Like, I would never thought that would be me as a patient. And I walked in, and everyone was significantly older than me in the room, and everyone's giving me the side eye and looking, why is she here? Why is she here? Right. And then one day I had a 13-year-old in there, and how humbling was that? And I thought, we're all in here. Like, we're all in here together, and that's going to be really important to kind of lift everyone up and understand that it doesn't have to be a short journey, a long journey. But talking about that oncologist, I really wanted a multi-platform approach. I'm a holistic girl, right? I did my fellowship in functional medicine, and I know you're going now through a fellowship in integrative medicine. So how is that going to impact next generation? Because that's who I was looking for throughout my whole journey.
Yeah. So I'm glad you asked. So I think it's really important to kind of take a step back. In today's world, I feel like medicine is reactive, and I think you do too if you're taking that approach. But we are treating chronic disease. So if we can take a step back and prevent that disease, or educate patients how to take care of themselves, what they can do to prevent having to go through what you went through, then I think that's where we're doing the most good. And so I went through my own journey this year, and realized that I wasn't practicing medicine the way I really wanted to. And I think that what I mean by that is, yes, I could tell you to eat healthy. Yes, I could tell you to exercise. But if I'm not giving you the tools or teaching you how to do that, or doing it myself and taking care of myself, then I'm not doing a benefit to my patients. And so I felt like I really needed to reset my life and reprioritize things for myself in order to be a better physician to my patients, and a better mother to my children, and a better wife to my husband, and in general, just all around better. And I think that what we talked about before, how life gets in the way, and then you get into the day-to-day grind, you forget yourself sometimes. And so that's how I decided to go into the integrative fellowship, is because I think that I've had a lot of patients come to me interested in alternative therapies. Now, as an allopathic physician, of course, I believe in the treatments that we're recommending. They work. They've been proven to work. But that doesn't mean that there aren't complementary or alternative therapies that we can use to help make that journey easier for patients. And I've always felt that way. But not always have I either been educated enough on how to do that, or had the resources to refer my patients to get those therapies. One thing I don't want is for patients to say, well, I'm only going to do holistic therapy. I think that there is a role for some holistic treatments, but complementing the standards of care, because we know that these medications, this radiation or that surgery, we need those to be able to try and cure the disease. But say you have nausea, say you have hot flashes, night sweats, anxiety, those things can be treated in other ways, and so you don't have to suffer through a diagnosis of treatment. And I really want to make my future role in medicine, one where I'm educating and helping guide patients, like you were saying, navigate the system, find the resources they need, or provide them myself in my own clinic to allow them to feel whole. And I think that self-care is so important, but it's so overlooked. And so I'm starting with myself, and I'm trying to educate myself and trying to make those changes in my life where I'm eating healthy, exercising, taking time to read and spend time with my children. And not everyone, has the opportunity to do that, but I think that we have to be very intentional about putting those things in our lives and taking time for ourselves. Whether it's half an hour a day or an hour a day, just taking time to be quiet within our minds and slowing down a day so that we can take care of ourselves, so that we can be better at taking care of others.
Yeah, I love that. And being intentional is really important. And I agree with you. There has to be a combination. Look, I'm not, we're both MDs. We went through our traditional medicine. I think where it falters is the component that we can do to kind of help us stabilize ourselves emotionally, stabilize ourselves physically. So I recall during my radiation treatment, they tell you to put Aquaphor so you don't get a burn. Mm-hmm. And I thought, well, that was kind of dumb. So I literally went and invested in growth factors, and I would rub growth factors on myself. As soon as I would get out, they would laugh at me. I'm like, I would not put my shirt on until I made sure all my growth factor was on there so that I didn't have any burns, so I didn't have any downtime. I made sure that I was getting my IV therapy once to twice a week at the time with glutathione and vitamin C, because there's so many great studies. And so the first thing, though, I will tell you is you need it out. Like, that tumor cannot stay and grow and grow and grow. You get it out, but now you can heal your body. There's so much fatigue and there's so many things that radiation and chemo do to our body. So if we can kind of incorporate a wellness program that's going to help the patient heal and make them feel better, there's no reason to feel so absolutely miserable during our treatments if there's something else that we can do to empower that person to feel good. It really does help us just physically, emotionally. It helped me a lot going in and getting my wellness treatments.
Absolutely. And that was one of the things that patients were coming to me asking for things. But I feel like it's sort of a slippery slope, right? Because patients can go and buy supplements, or they can go and, get treatments by someone who maybe isn't well educated. And that's why I think, like, as healthcare professionals, we really need to be the ones to initiate getting the education, learning about all these alternatives and complementary therapies, so that when they do come to us asking about them, not only can we say, yes, I agree with this, but we can also say, no, this is going to interact with this medication. It might make it more harmful to you, so that patients aren't just going and buying things and trying things that could alter their treatments and make it more harmful. So first, we need to make sure that whatever therapy we're offering, it's not going to do harm to the patient.
Yes.
And so I think that educating the patients is really important. But then going a step back, if we are all as healthy as possible going into a diagnosis, then coming out of it, you're going to heal faster and feel stronger, and maybe the treatment will be easier. So I do think that, education is key. Learning how to be at your healthiest before you even get a diagnosis, maybe even prevent a diagnosis because you're eating more healthily, or you're exercising, or you're taking care of your body, you're doing your supplements. I mean, I think that's also where the functional medicine is, looking at how everything in our body is connected. And, your GI system is connected to your brain. If you have a healthy GI system, you're going to be cognitively better. So I think it's really exciting. I think that healthcare is at a turning point. I think that there is a need for more patient-centered care, and I'm really excited about the future, because I think that looking at the whole person and caring for the whole person is going to become more important again, or maybe it's gotten lost in the shuffle a little bit.
So as you can see why she's so amazing. This is why I chose her to be my surgeon. This is why she continues to help me go through my journey. It never ends, but it does get better. And that's really important for people to know that. And so before we conclude, I want to ask you our one question that we like to ask everyone, and that is, what does beauty mean to you?
Well, I think, when you say beauty, people often think of the external. And yes, that's one type of beauty. But for me, someone is beautiful when they really love themselves and empower themselves and are strong. And so I think that, one of the beauties of being part of these women's lives is seeing that most women don't realize how strong and how beautiful they really are. And I think once you go through a breast cancer diagnosis and treatment, you realize that there's really nothing that you can't do if you put your mind to it.
I love that. Thank you for joining us.
Thank you for having me. It's been a pleasure.